Okay, hi everybody. We're going to get started. Looks like pretty slim attendance at this point, only 26 people on. But we'll give you the information as we've got it at this point. Remind you to please mute your microphone and use the chat box if you want to ask a question. Just type in something in the chat box. We'll take a look at it and try to answer your question. Next slide. So our reflection for today is listen and attend with the ear of your heart. Saint Benedict of Nursia.
Beautiful picture.
Yeah, nice picture. All right. Just on Common Spirit updates, we just finished our employee survey. So thank you, everybody. I think we got the highest percentage of participation we've ever gotten. And we beat out everybody in the Central California division at 86.03%. Right behind us was Memorial at 85.46. And then St. Joe's Medical Center, Mercy Merced, and then Mark Twain, and finally St. Joe's Behavioral Health up in Stockton. So thank you, everybody. I like it that we have gotten that much participation. I do look at all of this stuff personally. I look at all the comments. We will be working on action plans that come out of this. So the fact that we've got 86% participation means that we get much better picture of what folks are thinking, and also people get pizza parties and all that other stuff that we were providing as incentives to your departments. So anyway, I do appreciate that very much. Next slide. Some hospital updates. Next slide. Oop, back up. There we go. For those of you who don't know, we have purchased a second robot that we are putting out at Mercy Southwest OR. We're currently doing some work in order to get that up and running. The robot has been delivered. Roy has been working with some doctors to get them signed up for using it out there. We're going to start them on Fridays out there initially, and then expand as we can with staffing as it allows. So we're pretty excited about that, the second robot, to complement our very, very, very successful program here at downtown, where we quickly became one of the leaders in robotic surgery in the community, if not the leader, I should say. Even yesterday, our team was meeting with one of our Common Spirit Health hospitals from the Midwest who wanted to know how we did it. So I think that's good recognition that we're doing things well, and congratulations to the team for making our center what it is and accredited as it is. Next item. So this is pretty cool. Congratulations to Kelly, who has been leading the charge for raising money for Leukemia and Lymphoma Society. You can see she raised $28,132 and was named the Woman of the Year by the Leukemia and Lymphoma Society. So we want to congratulate Kellyanne and thank her for all of her hard work, in addition to all the other things she does for that society, and we're grateful to her for leading that for us. Next. Hashtag Health It Forward Bakersfield. Share a selfie of how you're staying healthy. We're asking to submit images, videos, stories of people like Donna there running along the running path, wherever that is. I don't know where that is, but please submit anything you'd like that goes along with that, even, I guess, your food, and even share a photo of you getting your flu shot or vaccination shot. And apparently there's prizes, winner every 2 weeks, from local businesses in Kern County. So there's that. Next slide. We know that oftentimes your coworkers become some of your closest friends. With Best Friends Day coming up, we'd like to showcase those friendships. If you have photos of you and your work BFF, please submit your photos no later than Monday by noon to Michelle Oliver. You see the email address there. No Snapchat filters, please. Those can be pretty funny. Voluntary basis and select photos will be used for National BFF Day. Social media post on June 8th. By submitting a photo, you understand this will be used for social media and will be posted on our accounts if selected. So please feel free to submit for that if you so desire. 2021 Virtual Walks for Kids is Saturday, tomorrow. It's not too late to register. If you haven't, make a $25 donation to receive a Walk for Kids t-shirt and be entered to win a Ronald McDonald House swag bag filled with goodies and gift cards. We just got all kinds of giveaways going on in this town hall. So register at walkforkids.org. If you don't want to register but still want to purchase a t-shirt, you can email Fabiana at her address there. And you can see the cost and the sizes available for that t-shirt. Next slide. Miscellaneous updates. So for some time we've been talking to you about how we were going to change our orthopedic clinic, our urology clinic, and our women's clinic in the 500 building into what's called A clinics. And this is done for business purposes because as a D clinic in a department of the hospital, we have not been able to take advantage of some of the commercial insurances because of the application of high cost hospital pricing to those clinics. So we've just been working through establishing what's called A clinic, 1204 A clinic, and we're doing that with the Pacific Health Centers that are from the Central Coast, who have been up and running for many years, and they have over 200 doctors in their clinics there. So we're working with them. They're working with the doctors in each of our clinics here to put them under contract with Pacific Health Centers. I think that work will be mostly completed by the fall. The physician contracts need to get done first, and then we finish off the licensing and legal process to get those converted to A clinics, which we think should happen by October 1st. And then that'll allow us to serve all of the insurances that so far have not been able to send their patients to our clinics. That's really kind of a big deal, and we've been working on that for a couple of years, so we'll be getting that done. The tower, everybody wants to know about the tower. We are in the final approval process this month. So by the time we do another open forum next month, you will know whether we've gotten final approval for construction start. Assuming we get approval this month, we can be ready to go in as early as 90 days or less, as the contractors and whatnot are getting geared up and they're just about ready to go. So June's kind of a big month for these top two items on our list here. Hopefully we can get that final approval. One thing you may have heard through the grapevine is the cost of this tower has just gone up crazy. It's gone up $50 million just in the last 6 months. It is now priced at $350 million. Just over 2 years ago, it was $248 million. So it is fully $100 million more for exactly the same thing. That has nothing to do with us changing the design or adding anything. It is simply the cost of construction has gone up exponentially. So anybody out there who's been trying to buy a house or build anything, you'll know that everything's gone crazy. I saw a funny post on Facebook the other day. It was a picture of a pickup truck with a trailer with some lumber on it, and the person posted, "I saw a millionaire the other day." So, yeah, it costs are just going up like crazy for construction items. I don't know of any other construction items that we need to talk about. Do you, Morgan?
Just that we've signed all the subcontractors, the commissioning agent, and the IOR, which are essentially the technical cops that will be working with OSHPD as we're working on the tower and getting it approved through the various regulatory bodies. We are doing our pre-planning right now for the various make-ready packages, looking at the potential for the disruption in the certain areas, first starting in imaging and in the ICU at Southwest. So I've been thinking about opening up the incident command once we get started and communicating the timelines for the various areas that are going to be under construction.
Okay. All right, very good. The only other thing I want to mention today is we had a long call with the corporate office that all the hospital presidents did this morning. The topic was the vaccination situation process. As it turns out, the corporation's not able to assess completely because of just different ways of record keeping. But it looks like 60 to 70% of all Common Spirit employees have been vaccinated at this point. They are encouraging us to encourage you, for those of you who have not been vaccinated yet, to please go ahead and get vaccinations. There'll be more to come. There was some discussion about masking guidelines and this and that. It looks like they're going to be submitting a new policy by the end of the month for July 1st. I suspect that they'll loosen some of the restrictions, but I think for the most part they'll be pretty consistent with what we're doing right this minute. And I don't know what that means for visitor policy. CDPH in the states still have to tell us what we can do with our visitor policy. It has been lightened up a little bit since I think the last time we talked, where all patients can have a visitor except those with COVID, I think is what the deal is right now. And then we obviously have some special situations, end of life, that we've always had that where we allow more people to come in. So don't have all the answers on all of that yet, but just kind of stay tuned on all of that. And we'll give you further updates as we get them. So, okay, next slide, I think, is patient experience. So, Joan, if you want to, are you on?
I am on. Can you hear me?
Yep.
So a lot of you have already seen some of this data, but our patient experience score for our corporate scorecard through March has Mercy at the 30th percentile, and that's a roll-up of all of the different categories of questions for HCAHPS through Press-Ganey. Our goal was pretty aggressive this year at the 57th percentile, so, certainly quite a bit off of where we would like to be, but we've had a lot of wins this year, and our measurement period ends with discharges as of May 31st. So we're just kind of waiting out for the rest of the year in terms of our scores. Right now, the goal for us between now and July 1st, which is the beginning of our measurement period, is to revalidate and just make sure that all the staff are super clear on good customer service practices, making sure that, we're anticipating needs and staying on top of things for our patients and really meeting their expectations. So a lot of the leaders are working on that right now. We have some assessment work we need to do the month of June so that we can start off July 1st really strong. And as soon as we know our goals, we'll be getting that out to the leadership folks. But essentially the measurement will be the same questions, the same domains, the same types of questions as HCAHPS as we've had the last couple of years. So want to just congratulate everybody for working so hard this past year to meet our patients' needs. It's not been easy, but you all and your staff have done a wonderful job. And so just really want to congratulate everyone. That the scores don't tell the entire story. And we know that, and we do get a lot of really great recognition from our patients. So please pass that along to everyone. And if you have any questions about patient experience, please just reach out to me or any of the vice presidents or Bruce. We'll be happy to answer your questions. Thanks.
Okay. All right. Thank you, Joan. And then we have some quality and regulatory updates. Am I doing that, or is
Stacy on?
Oh, Stacy, are you on? Looks like I'm doing it, which I'm ill-equipped to do, but I'll muddle my way through. So first thing to look at on our call, and this is a summary through end of March on our acute care quality. Our sepsis risk adjusted mortality, you can see, is at the 49th percentile, which is below both our baseline and our threshold and target. We've got some activity going related to that. There's a lot more in that meets the eye, including how they calculate the mortality with and without COVID. But nonetheless, we continue to concentrate on that. The ER and the physicians in the ER and staff, nurses have all been doing an excellent job with applying the bundle in the ED. Which is one of the main places where we catch these sepsis patients, and also on the floors and working with the hospitalists. A little bit more of a gap there to catch those and get those going, but right now this does not tell the whole story. And we still have opportunity, but we'll continue to work on those items. Going on down below, some of the other acute care goals. On the left is the blood usage. We are exceeding our goal there, and we have been for a couple of years now. We've been one of the highest in the company and the best in the division. So we've been doing a great job with that. Actually, I think they're going to drop that measure next year because everybody's doing so well with it. It's kind of hardwired into our clinical efforts at this point. Next to that is low-risk C-section. We are now exceeding our target. They've done a great job in the Family Birth Center and the doctors and nurses there, staff to work on that metric. And we've exceeded our baseline and our target in doing a great job there. Readmissions is the next one. You can see that we're just short of our goal there. It's been challenging. We're doing some deeper dives on what's leading to some of these readmissions and working with specific physicians who may or may not have a higher rate of readmission. So we're just kind of short of our goal there. Looking up on the upper right is our HAI composite. It's at the 46th percentile, which is below all of our baseline threshold targets. And down below, you can see some of the information that goes into that dashboard. CAUTI, catheter-associated urinary tract infection, we're well below our goal, well below our baseline. There's been a lot of effort. Many of you are aware of the rollout of some of the steps we've taken to try and get at that issue, and some change in practice that's gone along with that, although it's really not reflected in this data, looks like in April and May we've made some good progress with that. Second one is C. diff is at 100%, knock on wood. We've had really good experience with that all year. That hasn't always been the case, but with the attention to cleanliness and other things as we do, we've gotten that metric up to 100%, which is awesome. Next one, catheter central line associated bloodstream infection. Again, this is another one where we've had some trouble. We're below our baseline and our target. Again, there's recently been a modification to our process and what we use to cleanse the area, et cetera, et cetera. I know that process is relatively new, but hopefully we will be able to knock down some of those infections that we've been seeing and reach our target with that. And the pressure injuries is the last one there. We're above our baseline, close to our target. Again, a lot of work going into that. There's been a lot of effort over the last few months because what was being characterized by the state as a pressure injury was really what they're calling COVID skin, which is not related to actual pressure, but it kind of fell in that category. So they're working on that and trying to get that separated out from our other data that goes into that category. So those are kind of the main things that go into our HAI composite. There are other things, but these are the big ones that we're going to be focused on. So one thing I did not mention in the other updates, and this goes under the patient safety category, is we've undertaken a process for high reliability organization. And many of you were probably talked to or surveyed by representatives from HPI, which is a Press Ganey company, which is going to help lead us in this effort for patient safety. This is going to be a huge focus for us going forward. I found it interesting some of the data that was collected from interviews with you all and with doctors about things related to patient safety. We've already changed up our debrief in the morning. We've started establishing some ground rules for how we're going to get at this. We'll be getting a lot more support from the corporate office and from this HPI company to help move us forward with patient safety. I don't have some of the data that I probably could have included. Maybe I'll do that next month. That just shows you what the last 2 years of experience has been at Mercy Hospital related to patient safety, including avoidable deaths, permanent harms, and interventions needed to save people's lives. I think it would be somewhat surprising to you all, and I'll probably make sure I show that data next time around. But please be prepared for a huge, huge focus on patient safety. What's interesting from the survey, from our staff perspective, they believe that we have cared more about patient experience than patient safety, and which is good because in a lot of hospitals around the company, most of the staff think that all we care about is finance. But apparently we've been talking about patient experience enough that's kind of top of your mind about what we what you think we as an executive team care about here. But you know, it's not a zero-sum game. Because we care about patient experience doesn't mean we don't care about patient safety, and vice versa. All of them are important. But we need to put a lot of effort into patient safety right now because we have a lot of opportunity there, and I think it goes hand in hand with patient experience. All of that is tied together, and it's what we hear about from our patients in surveys. They're happier when they perceive that they've gotten better quality care, et cetera, et cetera. So a lot more to come. This is going to be a long-term effort over multiple years, so it's not something we start and stop and say, yeah, okay, yeah, we did that. This is going to be a big deal, and it's going to be ongoing probably for the rest of all of your careers here. It's important, and it's worth all of the effort related to that. So with that, we'll go to the next slide, and Ben, if you're ready, you can talk a little bit about this.
Yeah, so I'll highlight kind of our EBITDA. And our EBITDA is our earnings before interest, taxes, depreciation, and amortization. So if you look there, April, we actually ended up at about $3.46 million EBITDA compared to our target of about $3.7 million. So we were a little bit less than 300K off of our target for the month. So pretty good results for April. You know, considering where I was projecting that we're going to land. So very pleased with those results. And then if you look at where we're currently sitting at as far as our actual fiscal year-to-date results, so we're 10 months into the fiscal year, we're sitting at 52 million compared to our budgeted target of 31.6 million. And then just as a reminder, what's included in that 52 million is the a piece of property that the foundation completed a sales transaction on that resulted in about a $21 million gain. So if you exclude that out, we would be right at 30.6 million actual EBITDA compared to that budget. So just about $1 million off of our target for fiscal year today, which I consider to be pretty good results given the impacts that we've seen as related to COVID and a loss of elective procedures earlier in the fiscal year, about midway through the fiscal year. We did see a significant impact there. Productivity, and you'll see we actually just finished and closed our pay period ending May 29th. And I'm pleased to state that we actually ended up at 100% of our hospital overall productivity goal. That was excellent results to, attributable to all of our departments, and the diligence to staff to the volumes coming in the door. That was actually the first time that we've hit that 100% since January, early January. So it's been about 5 months since we've been at 100% overall productivity. So kudos to everyone's hard work in delivering those productivity results. And then you'll see on a year-to-date basis, we're sitting at about 98.8%, which is pretty good results given that, we had some months that's down as low as 90%. So pretty pleased with our productivity results so far. And that's really it, Bruce.
Okay, thanks, Ben. All right, actually, I don't see anything in the chat, and so we don't have any more questions. Appreciate you joining us today. I think with any luck at all, I'm going to see if we can't start these in person again in July. I'll just have to see what happens with our guidelines and things. But I'd really like to get in front of all of you again and do this in person. It's just a little awkward on a Zoom call like this, and I like the interaction that I get with the in-person meetings. So we're allowed to. I will probably start these up again in person in July, and so look forward to doing that. Again, thanks everybody for all you do hopefully everybody will get away for some vacation this summer, and relax, recharge, all of those things, since we're enjoying a little bit of a respite from the surges from COVID, et cetera. And everybody can take some time off and take that well-deserved time to be with their family and friends or whatever you like to do. And I look forward to seeing you all in July. So again, thank you. Appreciate all you do, and see you next time.
Thank you, Bruce.
Bye.